Firstly, I think when we deal with two different illnesses, we have to look at them separately on one level, and on the second level, we're going to see whether there's any interaction in terms of the treatment for them. So, for example, if let's say the cancer treatment results in nausea or poor appetite for a limited period of time, then sometimes the diabetic medication may need to be adjusted. Otherwise, the patient may experience what we call a hypo or hypoglycemia, which is actually a low sugar episode. Other scenarios in which the treatment of one condition may interact with or affect the treatment of the other would be in situations where the patients have to go for procedures and they have to be fasted for the procedures. So in those situations, then again, generally diabetic medications would be stopped. Thirdly, there also may be scenarios where certain treatment actually worsen or cause kidney problems or renal impairment, and in those situations, certain diabetic medications may have to be reduced in dose or even stopped. One of this may be metformin. Yeah. Okay, so the second part of it is whether the cancer treatment itself affects the diabetes. In general, cancer doesn't really affect diabetes per se, but certain treatment for cancers may affect or worsen the diabetes. And one of them would be a very good well-known example is actually the use of steroids. So steroids sometimes are used in certain cancers, including lymphomas, and steroids are also well known for actually causing the sugars to deteriorate. But thankfully, these are often just temporary, and when the steroids are stopped, the diabetes usually goes back to its baseline. So in the interim, they may need additional step-up medication to control the diabetes during that time.